Video. Very good morning to one and all. A hearty welcome once again to this webinar series. Before you get into the webinar, I just want to speak a few lines about our MNR Educational Trust and more so MNR campus in Sangareddy, which is a higher education campus and research center. A hearty welcome once again to this webinar series. Our chairman, Sri M.N. Raju Garu, he believes in the mantra of I can rather than I give. MNR campus in Sangareddy, which is a higher education campus and research center. Hearty welcome once again to this webinar series. Continue. Yes. Following the footsteps of his father, our vice chairman, Sri Ravi Verma sir, he also motivates, inspires the younger generation in the campus, and together we try to formulate and impart quality education to the society. And coming to our College of Nursing, we have well-experienced, dedicated faculty who impart quality education to the students, and we have our labs, library, and parent hospital, which is all well equipped for a nurse to be skillful in the future. So all this webinar series will help us to be more up to date with the present scenario. And for today's webinar, over to Manasa to explain and introduce the speaker to you. Have a good time.
Thank you, ma'am. Good morning, everyone. So today we have the speaker, Dr. Selvarani. And Dr. Selvarani, actually, she is the doctorate. She has completed her doctorate in community medicine and holding nearly 22 years of experience. And she has held good academic and administrative positions in last 22 years of her experience. And she has various experiences in her field, even in India and abroad. So we are very lucky here to have her here. She wants to share her knowledge. I hope this will be interesting topic for you because it is completely rendered for you, that is impact of education on nursing, especially for students' perspective. So I hope you will gain knowledge through her discussion, and please feel free to ask any queries you have. And yeah, so welcome, ma'am, and greetings for you from MNR College of Nursing, and you can start up your session.
Hello. Hello. Am I audible?
We can hear you. Yes.
Okay. Shall I start?
Yes, please.
Okay.
And you can switch on the video.
Share the screen now.
Yeah.
Is it okay?
Suppose so.
She's actually making
Is it okay?
just a minute, doc.
Yeah.
Let us proceed. Okay. As it proceed.
Yes, Doc, you can proceed.
Okay. A very good morning to everyone. Professor Shobana, a principal, MNR College of Nursing, Dr. Manasa, for specially inviting me and to introduce me on this platform. I'm happy to accept your invitation, and I'm humbled to accept your invitation to go with this webinar series. And to all the audience, I hope I can do justice regarding this topic. And special thanks to Mr. Suresh Babu, the technical assistant, for having all the trial session and to be with us throughout the session, and to all the audience. So as we are all waiting for the beginning of the session, so going to the session, as everyone throughout the globe, we are in the midst of COVID-19, and we thought by end of 2020 would be the end for COVID-19, and the new beginning of 2021 would be without COVID. But unfortunately, we are continuing with COVID. So the COVID has a great impact on all sectors or all the walks of life across the globe. And we are not exceptional. I mean to say the nurses or the nurse educators and the nursing learners or the nurse students. So we are not the exception. We too have affected in all the aspects, in our practice aspects, in the education aspects. So here today, I'm going to share my views or the experience which I learned and I practiced. Of course, I hope many of how we had a great time, a great difficulties in the beginning of the COVID lockdowns. And of course, it's continuing. So we'll go with this. So the objectives of today's webinar is, at the end of the session, the audience or the group would identify the emergence of COVID-19 and its outcome. Of course, everyone is well aware of it, but it's my duty to introduce and the impact of COVID-19 on nurse education, how we have transformed or the transition of nurse education in the beginning of COVID lockdowns, and what is now and what is ahead, and the challenges of nurse educators in delivering online classes, and how to overcome those hurdles, and the impacts on students' mental health. It's very important because we all were in a confused mode when we have started with our COVID lockdowns. And what is the emergence of COVID-19 issues, which is perceived by the students, or I can say the students' perspectives, and what I had throughout the lockdown period as a result of the transformation of nurse teaching and the learning experience. Of course, we all had challenges, but it has offered some advantages too. So we'll see that. And since the learners or the host is from India, I just want to share some of the Indian scenario also, and the importance of empathy and resilience during this COVID context and what are the topics to be included to develop our nursing students to overcome this resilience and the empathy, how to develop the empathy. And the online teaching post-COVID is the permanent transition, or we would come back to the normal life. And finally, moving towards the development of nursing curricula, which is matching with the pandemic, and now and forever. So the emergence of COVID-19 and its outcome in the December 2019 in Wuhan, China, it has boomed. And we never thought that it is going to cross the country and it is going to affect overall the world. But it has. It had affected very badly. And this outbreak of novel coronavirus has led to an extraordinary global health emergency. And as a result, all the countries have started its own measures, and the United Nations or the WHO has started implementing the way to control the spread of the infection. So as a result, the attempts to control the virus included the social isolation measures and the avoidance of social gatherings, which have resulted unprecedented worldwide lockdown. And in turn, there was a drastic change of the way in which the people live and work across the globe. And we all have been inside our shell, or we were living inside our home. And we have been disconnected with the world or with the society or with our acquaintances and the world. And the lockdown affect such almost all sectors, which made a large impact on the economy in most of the countries. And as a result, like all the sectors, which means the transportation, the hotels, malls, restaurants, tourists, and the public sectors, of course, the education sectors of the school education and the higher education too. And many of these sectors were reopened, followed by certain period of lockdown worldwide. And each country has set its own the lockdown period. And I'm sure in India, after the period of 70 days or 90 days, slowly they have lifted the lockdown as with each sectors, but still in the education sector is or closed. It's remained closed, especially for the school education. And very recently, a couple of months ago, they have started as a trial basis, they have started lifting or lifted the lockdown for the school education. And they have started, and again, they had found very difficult to continue with it. So it's in the transformation of online education methods right from the lockdown, and still it's continuing. So when it comes to the impact of nursing education, so here the COVID-19 pandemic has caused the widespread disruption to nurse education. So the lockdowns and continued measures to ensure the social gathering have resulted in the termination of campus-based teaching and enforced home-based working for both nurse educators and nursing students. So I hope everyone knows the campus-based education or the teaching. Here we educators have a very good plan of execution of our teaching. But as a result of this lockdown, we all had shut our college or the campus, and we have switched over to the online education. So this transformation of traditional face-to-face methodology to online distance education and learning enforced a number of challenges to the educators as well as to the students. So what are all these transformations or the transition of nurse education? The first and foremost is online classes of theory lectures. And here we can see it has started with to be frank, I can say that we were not been well versed with the online classes, although we have online platforms in our university. So I was thinking where the country or the institutions where they don't have a regular online platform. So they are all much confused how to go with the theory classes. And the students on the other side, they were thinking how they are going to complete their classes and how they are going to complete their semesters. So that's the first transition which has made in the imparting the education, especially the theory lectures. When it comes to the second part, that is the alternative clinical experience, as we have in importance for the theory and the clinical experience or the clinical teaching. So here, as a result of lockdown, and we have cancelled all the clinical experience, that I mean to say clinical postings. We have cancelled all the clinical postings. And I hope, but I'm not sure, the clinical postings have not yet started in India. Here, where I'm working in Saudi, we have slowly started with a different method of clinical experience. And we, of course, in this semester, from this month onwards, we have started the clinical postings that we are going to, that I'm going to explain later how we have started with that. And the third part is evaluation of students' performance and the grading. In simple, I can say that our examination pattern, how we are going to, or how we had evaluated the performance of the students' activities in terms of theory as well as in the practical performance, and the grading system also. So on the basis of evaluation, we grade it A, B, C, D. But here, as a result of lockdown and the transformation of the cancellation of our traditional method of teaching, and we had imposed to change our method of evaluation for the performance of students also. So these are all the main transition which we had experienced in the initial period of lockdown, and still it is not resolved. And partially we have shifted from the online to teaching, and still we are continuing for some of the courses online teaching, online and the offline mode or the traditional mode. But still, we have not yet come to a clear picture how we are going to continue with this. Now, coming to the challenges of nurse educators in delivering the online education. Firstly, a clear difference between emergency distance learning and robust online education. That means when he has started with the lockdown, it's rightly speaking 1 year ago, during the month of March, April, we all were in a confused how to go with this, because we have not been well prepared to execute the online teaching. It was like just to handle the emergency situation. And we have not been trained, or we have not been prepared to change all our content or the lectures or our teaching mode. So we need to, we are in the need of systematic approaches to make the transition of online teaching and learning as successful and permanent method of online education. And the second challenge was very visible disparity issues that affect students' ability to learn and be successful. It means the lack of access to the internet and the Wi-Fi due to either the financial constraints or the geographic location of the students' residence and availability of the laptops or the computer facilities. So here we can see that the students all as well as the educators, we all confined to our homes. So here the problem of the technical support, like the internet speed or the Wi-Fi speed, and which it's abruptly, which has interrupted our, what to say, like the method or the mode of delivery. And again, the financial constraints, the cost of getting the data package or the Wi-Fi or the broadband internet for the students as well as to the educators. Like those who are living in the usually the connection, the net connection or the Wi-Fi connection is very poor. So that has affected a lot. And finally, the availability of the laptops and the computers, not necessary to say that all students had the facility to access their online education through their computers or the laptops. Of course, I know that some of the students had attended their online education only with their mobile phones. So these are all the second challenges which we had experienced in the beginning. Of course, still we are experiencing the same challenge. And finally, the provision of clinical experiences by the use of simulation, telehealth, or the virtual reality. As I have mentioned in the previous slide, the great impact on the clinical experience or the clinical learning or the practical learning, I can say. So in the practical learning, we take the students to the laboratory. So we educate the students with the simulators. But as a result of closing, and we had a very difficult time how to experience or how to simulate to give a practical education to our students. So here the alternative was only recording the simulation, or we can simulate in the high fidelity format and we can reach out to our students. Where the places like when we had not been with the resource of high fidelity, either the high fidelity simulation or the low fidelity simulation, as well as the platform, how we are going to deliver to the students. It was a real challenge. And when we had not been provided with the resources, we had very difficult to explain to our students, to give our clinical teaching. So this was a real challenge. And so we need to see, or we need to rethink how we are going to provide this practical experience to our students. So coming to the impact on evaluation and grading. So here the redefining how students' performance is evaluated and graded. So when it comes to the point of the performance evaluation of the students, for the theory, we conduct the examinations like midterm examinations or the final examinations. So I just want to share our experience in our university, what we had in the beginning of lockdown or the beginning of the COVID. So here we have cancelled all the online in the campus education, and we have switched over to the online education. So it was supposed to be paper pen test. Paper pen test was the method of the mode of evaluation of our theory education. So here everything has been shifted to online education. So we have constructed the tool, and that has been uploaded in the platform named Blackboard. That's the platform which we use it here. And we have evaluated the students. So here, the evaluation is restricted to the type of questions. So the type of questions we have adapted only the objective type of examinations. It was like we had not been provided with the subjective mode of the subjective method of evaluation. So we have obviously we had changed to the method of evaluation. So we had to change the method of evaluation, and we have conducted it. And I know in India, all the examinations, the final examinations has been postponed from August or September, and it has restarted after the after the lockdown is completed in the month of November or December, I hope. So that was the real challenge we had. And secondly, coming to the examination procedures. So here, especially, I just want to mention about the examination procedures concerned to the practical examination. Also, like we heard, we conduct the practical examinations in the hospitals or in the clinical field, or we conduct in the laboratory. So here you just think of the examinations were great in conducting the examination. So as I said earlier, we had conducted even the practical examinations of our first semester last year, the second semester last year during the lockdown through online. So the same mode, like the objective type of examinations, or giving the clinical scenario and asking the students to perform the care plans, and conducting the quizzes through online. So that was the mode. So really, just we are thinking like we totally changed. We totally altered the method of clinical examination procedures also. And many institutions have moved to either pass or fail rather than giving the grading system. So that was the great impact on the evaluation or the grading of our nurse education system. We had in the beginning of our lockdown, and still it is going on. And in India, very recently, I came to know that the final year examinations have successfully conducted with the clinically, the practical examinations had been conducted in the clinical area, and the theory examinations also conducted as a traditional method, like paper pen exam. But it was not so in other countries across the globe. And still in Western and in UK, the exams were conducted only through online. And so here the final year graduate or the postgraduate students, they had very challenging time when it compared to the lower grade or the lower level of students. So these are all the challenges in terms of theory classes or the theory lectures and the clinical teaching, and coming to the evaluation area. So how we are going to overcome these issues of online classes. So this, which had experienced by all the nurse educators across the globe. So how we can overcome? We can overcome by preparation of well-developed plans for the online teaching. And as I said earlier, we were not well equipped, or we were not being well exposed to prepare the lectures for the online teaching mode. Of course, we are all thorough in doing, or we are expert in doing the traditional method of teaching. So the preparation it's a highly essential, or it is to match with the online teaching. And second, coming to the presentation of online teaching information in a low fidelity format, where the high fidelity format is not matching with either the resource or the platform which we use it, or we can think of the student's perspective, like whether the students are provided with the um, high speed internet facility, as well as the resource or the laptop or the computers have the access to receive the lectures or the online presentations, like PPT and the voice PPT or some higher options. And coming as well as the alteration of percentage of direct patient care student contact hours by the regulatory bodies. As we all know that the regulatory bodies of each country, or they are specifying like how many hours of clinical practice to be completed by each level of nursing years or in the semester. So here, like as a result of our closing of online, the campus-based or the traditional method of teaching, and we have propelled to change the percentage of patient care, because the students have not been sent to the clinical area to continue their clinical experience. So how to resolve it, or how to solve this? So here the regulatory bodies are the accrediting bodies, like in India, the Indian Nursing Council or the relax, or they have to go with some kind of alteration in reducing the percentage of patient care contact hours, like 150 hours of clinical experience in the field of in the subject of community health nursing, or in the obstetrics and gynecologic nursing. So it was not conducted as a result of this lockdown. So how to go with this? So they can switch on to, like when the where the students can complete these contact hours in the laboratory. They can do the demonstration in the with the simulators, or conducting vivo, or some other type of method of education could be altered with that, so that the students can complete their the total requirement of nursing education, so that they can get their graduation and they can move on to their nursing practice. So this was the only way which we can overcome the issues which is related to the percentage of patient contact hour, which is mandatory to complete the nursing education or the nursing degree of all levels, the undergraduation level as well as in the post-graduation level. And also, the faculty must be clear regarding the effectiveness of technological software adapted for the teaching. So each institutions or each universities vary with their platform or the software used for delivering the online teaching, and which differ from country to country according to their resources or the level of execution of the platform where they can deliver the online classes to our students. So the faculty must be clear, like how and what to be, how they can handle it, and how they can deliver the lectures or deliver the practical simulations, etc. And and regular concentration will be necessary to change the mindset, to shift the online teaching learning from the traditional face-to-face methods. So here the mindset of the students as well as the educators. So here we should be very attentive and the methodical and the regular concentration, because we are not been used to this. So the mindset change with a very attentiveness, excellent attentiveness is another way we can overcome the issues of online teaching. And coming to the effective time management, teaching styles, and the paradigm shift from the traditional methods to online, and the content development delivery through the integration of multimedia. So the time management, because it's very important point I just wanted to say, like we need to prepare it and we need to upload it. Then we have to see that whether on time the students are all logging into the session and logging out, and the attendance, all those matters into the time management. And the teaching style. The teaching style here, when we have the traditional method of teaching, we have a very good interaction with the students. The lecture come discussion method we go with us, and the demonstration, lecture come demonstration. So here in the online teaching, we have to adapt the method of teaching or the style of teaching according to the restrictions. We had a restriction in when we go with online teaching. So the style of teaching to be well planned, and we have to well design it. And the content development. So the content of our lectures and the practical classes, the concise and brief content to be developed, and the delivery also. So the delivery through the integration of multimedia. So the multimedia, all multimedia has been integrated, and I hope everyone is agree with me. Like we used all kinds of multimedia, like right from the WhatsApp, Facebook, YouTube, along with this online platforms, and where the institutions had not been provided with a regular online platforms, and they have started with this multimedia. Multimedia has helped a lot to deliver our teaching to our students in the beginning, and slowly we have transformed, on all institutions have find their own way of delivering the lectures or delivering the teaching to our beneficiaries or the pay customers, our students. So coming to the impact on students' mental health. So here, it's not only our students, everyone, all human beings, we had underwent a lot of mental stress as a result of this lockdowns, or in simple, I can say that the impact of COVID-19. So here, since my topic is related to the nursing education or the nurse students or the teachers, I just talk about what are all the mental health issues has been pointed out as a result of COVID-19 impact. So the first one is the anxiety. The anxiety of our students, like it's related to the infected family members or their friends, the relatives, or the acquaintances. So when they have heard about that any of their family members had been affected with COVID-19, they had an intense anxiety. And second one is the COVID-19 stressors. So the COVID-19 stressors are especially the economic stressors, and which had effect on daily life and the academic delays. So here, the economic stressors, which I can say that the paying capacity of everything. So the paying capacity in terms of our students' perspective, they have to attend online classes, but they don't have enough pay to buy their internet or the data package. So that had resulted intense stress over their daily life as well as their academic life. So the academic life, I can say that they had a real challenge of completing their assignments and submitting their assignments, and they were all tensed, and they had underwent a lot of stress. And the third impact is a quarantine life. own shelves. And we have not been exposed to anyone else. We have not been exposed to our friends or relatives or our peers. So here, this quarantine life is accompanied by various psychological, social, and the economical consequences. And we talk about the economical consequences here. Totally, we have been disrupted with the world or the outside world, and the parents have not been gone for work, so their income is affected. So when the income is affected, the buying capacity is, and the social life also. So we have not been gone to any social events. And for the students' perspective, they have not been exposed to their friends for sharing their experience or sharing their ideas or views, which was a regular life event for everyone. So that has been affected, and that has a very great impact on the students' mental health. And the social isolation and the depression has resulted even a number of deaths also. We had a scene in the news medias and in the newspapers, like there are lot of the drawbacks of this social isolation, and which has resulted immense which had led to a number of deaths also. Finally, the uncertainties of course, progress, and the evaluation. They all were in a query like, do we complete our degree on right time, or whether we are going to complete a year after? And what is the method of evaluation? How I am going to evaluate all my assignments and my final examination? So the uncertainty led all the students in a doubtful situation, like how and when I'm going to get graduate of my nursing. This has given all those has impacted on the mental health of our students. And what are the issues perceived by the students? The issues are, first one is the lack of internet access and the computers and the laptops. So that was the issues perceived by the students. So throughout the globe, a number of researchers or the surveys has been conducted to assess what is the level of stress or the level of knowledge and their perceptions related. As a result of these are all the issues has been listed out. So the first one is the internet access and the lack of availability of their resources for attending their online. One is the interruption of online lectures because of the internet issues and electricity issues. Or the power cut problems, they had a very a lot of interruptions in attending the lectures, online lectures, as well as the recorded lectures also. And the third one is inadequate knowledge regarding the media used, especially how to join the session, how to leave the session, or mute, unmute, and uploading their assignments or correction, how to correct, followed by the correction by their faculties. And I can say that like how to get the messages through the online platform. So the lack of knowledge or inadequate knowledge was the issues has been expressed by our students, and not understanding the content without queries. So here, when we have a traditional chalk and talk and face-to-face online teaching, we clear all the doubts or the queries then and there. Whereas in the online platform, the queries has been posted by the students in the online platform, and that in the written communication, and there was not not of much oral communications between the two, between the educator and the learner. So they have not been cleared then and there, their queries or the doubts, and they felt unhappy full attention from their educators. The time allotment, in terms of like the traditional classes, which starts at regular time, like morning 8 o'clock or till 1 o'clock or 2 o'clock, or it is till 4 o'clock or whatsoever it is. So that is the regular time they had been used with that. However, when we changed with the online, and we had changed the time allotment also, even it is in the evening or in the night time. For example, I can say that even now we are continuing in our university, our online theory lectures all have been in the evening hours. So in the morning hours, we do the clinical practice, as well as in the laboratory demonstration as a small group demonstration in the college, and all the online lectures are in the evening. So here, the students they have to spend their leisure time, or their exclusively their out of their own time. They have to spare their own time for attending their online lectures. So they were not much happy with it. And as well as they are not getting full attention from the teacher. Of course, obviously, everyone knows that when we have a face-to-face or in the personal contact, we have a lot of interaction. So that interaction and the attention was missing, and that was experienced by the students. And as I said in the beginning, there are some advantages also we had enjoyed as a result of this online teaching. So what are the advantages? First one is which allows a new method of teaching with access of advanced tools and technology involved in it. To be frank, I can say that when I was in India, I was not familiar with this online teaching. And after coming back to the present university, I was aware, like we had a platform for online teaching, just known as Blackboard, and I was not much oriented with that. What happened, like we were in the process of just getting the permission to go ahead with the online teaching. But as a result of this lockdown, overnight, we all have been informed that from the next day onwards, we have to start with online Blackboard teaching of theory as well as in the practical classes. So, like this has, although this has given a great tension and the stress, because I was not aware. And once we have started with that, we were learning each and every process, like how to create the lecture, and how to construct the lecture, how to construct the questions, and how to post it, and how to correct it. So we were in the process of learning the tools and technologies which were involved in delivering the lecture, and delivering or correcting the assignments, etc. So this is an advantage which we had experienced as a result of online teaching. We like the new method of teaching and accessing the advanced tools and technology. And second, it can reach to many students at a time. So we can deliver the lecture. The recorded lectures has been posted in the platform, and which were used for a lot of, or a group of students. It is not only in the traditional lectures on the traditional teaching, we are all confined to the classroom with the capacity of the total number of strength of 50 or 100 or whatsoever it is. Whereas here, even so many groups of students could be joined together under one university and they can get benefit. And so it is benefited to a large number of students. And students can acquire a knowledge of using tools and methods. As I said, for the teachers, the same experience for the students also. And pay much attention to recorded or the live conversation. So totally, we all have been transformed nowadays to attend the online teaching. A best example is the webinar series of MNR Education Trust you are doing and during this the post-COVID or the in the amidst of COVID period. So this is the best example I can say over here. And now this webinar, a live webinar is going on. All our students are getting the benefit. So our mindset now is changed from the face-to-face conference to webinars. So we are much fascinated with the webinars rather than. I hope in future also we would experience or we would appreciate more number of professionals. It's on our own pace we can attend if it is in the recorded form, in the live rather than the live conversations. That's a very good advantage. We all are benefited with the change of online teaching. And coming to the listen and watch classes, the other benefit is the students can listen and watch the classes many times in the case of recorded lessons or the recorded sessions. And working at their own promptness, both for the students as well as students, the nurse educators. And when we talk about the disadvantages, the first and foremost is inability to have face-to-face connect with the students and facilitate free conversations and discussions and mentoring. So as we had discussed from the beginning, the face-to-face contact with the students and the teachers, which had a lot of impact. We have a very good human touch and the expressions. All those things are missing in the case of online teaching, and the discussions also. Though we have the online platform through the discussion boards and through the chat messages, and even we can put the messages in the course and we can send messages in the WhatsApp. All those things are available. Instead, these discussions are limited, which were not as similar with the discussion when we have with face-to-face or in the personal contact, right? And the mentoring also. So if any student want to get any attention or guidance from the nurse educators, and they have to approach through email or some written communication, and the same way it is reciprocated with the students. So there are certain limitations are there. So that limitations could not be replaced as in the case of a personal face-to-face communication. And lack of online teaching experience, which consumes more time and the practice. Of course, this is an agreeable point, like for the students as well as in the educators' point of view. We need to have a lot of time for the preparation preparation, okay, for the preparation as well as the practice. So before going with the lecture, everyone will have some rehearsal or some mock test or something. Like best example, I can say that here this webinar, before going with the webinar, we had a mock trial. So this takes a lot of time. And the technological difficulties with the high-speed internet access, which is a killing effect. Like, so the technology is killing the time and our everything. So when the internet connection is not good in quality, and definitely we all experience some greater amount of stress and tension, especially in the case of conducting examination. Everyone will thinking like whether all my students have logged in or not. And even for the lectures, and we often tend to see that how many students are attending, what is the attendance, why, what happened. The students will send a text message saying that, doctor, I am not, my internet is very slow and I'm not able to get into that and it has disrupted. So all those things are the which gives a level of tension and the stress for both the students as well as the teachers, and difficulties in getting used to learning and being evaluated. We have seen this before, like difficulties in getting used to learn as well as being evaluated for the students and the teachers. Coming to online teaching in India, the challenges and issues, as being a developing country, and I don't know how many are going to agree with me. Like our higher education universities or the institutions, I hope not all the universities have hadn't started with their own platform of online education when it compared to the developed countries, right? And especially in the school education also. So the change of online teaching originates the challenge of sensitivity of learnings and the new opportunities that the technology offers. So I'm sure like and I have seen like in the school as well as in some of my old colleagues in India, they all had struggled how to um, start with their online classes for their students in India. Okay, so we had a lot of challenge in conducting the learning, conducting the teaching session. So this changeover has been easy for autonomous or the deemed and the private institutions in comparing to the public sector or the government institutions, because we know like the resources are not in comparable with the private or the autonomous institutions, especially in our country, it's in India. And this sudden transition of teaching methods to online classes made students and faculties in a confused mode. It's very true. They were not knowing like how I'm going to do with. Um, of course, they have started with uploading the recorded. They record the session and they upload the recorded session in the YouTube or in the WhatsApp. So they have formed a WhatsApp group of all the students. They have sent the recorders. So it's like it is not direct communication. Like, okay, so they had struggled a lot. They were confused, like how the lectures will be delivered, and the students perspective. They were thinking like how I'm going to get it. The student, even some of the death, I have read in the newspaper, the student don't have the personal mobile with the WhatsApp facility, and they got depressed and they committed suicide. So those confusions were there the beginning of our online teaching. So the ongoing online classes is now turned to the question of quality. We all had the question of quality and the justice. like parallel with our traditional teaching. So the quality is the point of question now. Earlier, the question is how and what of delivering online teaching. Now, the question is what is the level of quality of content. So the institutions have tried many methodologies during the start of lockdown to continue the curricula through the recorded classes, uploading in the social media or in the websites, as we discussed earlier. And the other method is live classes or the online classes. So here we need to have a kind of platform to deliver the online or the live lectures. And reaching the students through online classes, the institutions must have uninterrupted high-speed internet, the infrastructure, as well as the software tools. So that was the real challenge of our Indian scenario. And the challenges are mainly due to inexperience in conducting or attending the live classes by the faculty and the students, and the lack of preparation or support from the educational technological teams. So these were the challenges we had, and some of the challenges still we are experiencing in India. Now coming to the empathy and resilience. So here I can say that, like, in general, nursing means we have to do nurse our patients with empathy. So here, the empathy uh, is coming out of a training, and when we are failed to be empathetic in nursing or giving care for our patient, we don't do justifiable nursing to our patient, right? So um, when we are under stress, I mean to say the nurse or the nursing students or the nurse educators, when we are not in a good mental status or the emotional status, and we fail to do empathetic care, okay? So how to develop this? So that's what I'm going to discuss here, and especially in the context of COVID-19. So how best or how justifiably provide a nursing care in the midst of this pandemic. So here, being a nurse educators, we had a great role in shaping our students to develop the empathy among our students, okay? So here the patients justifiably expect to be cared with competence, kindness, and compassion. This is what attracts many students to nursing. But when nursing students and nurses are exhausted and burnout, it is unlikely that they can care compassionately for others, because already we are exhausted. Already we are in the state of burnout. As we can see, nurses are the front line and we had a lot of impact as a result of this COVID-19 worldwide, and recorded death as a result of exposure to COVID-19 patients. So this has resulted intense burnout among the nurses, fear and anxiety among the nursing students. So in addition to the challenges of healthcare practice that student nurses may experience in usual times, the advent of COVID-19 pandemic brings with a new reality. So already all nursing students experience a lot of challenge when they have been exposed to practice their nursing in the clinical scenario. So this advent of COVID-19 has given a new reality, like vigilant in protecting and providing the care to their patient and protecting their family. So the student nurses need to be supported to learn better, regulate their emotions through self-care practices, burnout, particularly within the context of this global pandemic. So in this unprecedented times, it is more urgent than ever to support students to develop emotion regulation, which will go some way towards supporting the development of resilience. Student nurses must be prepared for the current realities of practice and for making the experience of work and the outcomes for patients. The student nurses to be educated to become capable of resilience. That means to overcome their stress and anxiety of avoiding burnout by developing emotion regulation. Future nurse practitioners who built organizational empathy. As we nurse practitioners of tomorrow, so they have to be developed in such a way how to overcome their stress and not to become burnout. Okay, or we can say in simple, capable of resilience to build the organizational empathy of in their near future when they start practicing nursing. And this development of resilient strategies enhances the ability to be empathic in part, therefore preventing empathic distress and burnout. So what is the role of our students and more empathic and resilience? So the nurse educators have critical role in developing nursing students to be primed to work in this pandemic situation. Our curriculum must be evidence-based and needs to address the following topics in the development of personal as well as organizational empathy. To be included in the curricula for developing empathy among our students. So the individual resilience, like we can follow these strategies for resilience, and we can go with empathy, like we can teach our students to be empathetic and empathic distress, emotion regulation, and self-regulation technologies or the techniques to our students, and being compassion and burnout, and the professional and emotional boundaries. Okay, we should teach our students to keep away the personal things. The personal life should not affect. Should be a boundary between the personal emotions and communication, increasing emotional awareness, self-awareness, self-reflection, and how to perceive others' emotions and other empathic skills, and self-care practices of our students, and self-compassion to maintain well-being, including the self-care plans to improve the physical, psychological, and spiritual well-being of our students. Planning for self-care, they have to have their own time, our personal time, to look into retrospectively, like what is their role, what they had done, how to overcome, etc. And curious conversation, that is those conversations to which we go openly and with curiosity so as to understand another's or others' perspective or experience, and the straightforward language for interactions. So these are all the topics to be inculcated to our students through our curriculum to develop empathy among our students. When it comes to the organization and the individual's role in that organization, we need to include the topic or the context of healthcare practice, including the challenges and the organizational empathy and the leadership, a compassionate and collective leadership, approaches to listening to the organization voice, and how to be the part of the change in an organizational climate, and ways of being together, strategies to address workplace issues identified through listening and empathic or areas to be concentrated to develop empathy to handle the situation in the pandemic of COVID-19, so that our students can better perform in near future. So coming to the online learning following or the post-COVID, is it the permanent transition? Yes, we'll see. Currently, during the COVID-19 pandemic, there is a mutual understanding of the importance of online teaching and learning. Whatever the extent to which the delivery of nurse education is transformed following COVID-19, it is doubtful that there will be an immediate return to the former approach as existed before the pandemic. So I know now in MNR College of Nursing, almost all the students have been returned back to the campus based teaching, but still the question of clinical practice. So it's doubtful when we are going to return back to our normal life, which we had the pre-COVID or the pre-pandemic. So the uncertainty surrounding COVID-19, however, makes it difficult to predict how long any changes caused by the disruption are likely to be sustained for. Foreseeable future, a likely scenario is that nurse education will choose to adapt an integrated blended learning approach, returning to campus for a small group face-to-face conversation when it is safe to do practical sessions, while continuing on. So this is what we do now in our university. We are going with the blended learning, like for a large group, theory lectures we are conducting online, and we have made into small groups for the lab and for the clinical posting also. So we have blended into, or we have integrated into the blended learning of online as well as face-to-face. So what are the factors could determine the length of online teaching? The training for educators in the adoption and use of current and emerging technologies, which is going to determine how effective we are going to provide, and the length, how long we are going to provide the online teaching mode, and the availability of open concerned universities or the institutions, and the response and the collective voice of students. The students are the beneficiaries, and their response is a matter a lot. So these factors, we can say that how long and how best the transition of is going to be continued in this pandemic situation, or till the end of pandemic situation. What is more, it is important that nurse education should support the development of online communities and encouraging students to engage peers and nurse educators in the virtual environment, so that it can promote a more interactive and dynamic learning experience that face-to-face classroom-based teaching provides. but I'm sure that it is not parallel as of face-to-face classroom teaching. View the COVID-19 pandemic as an opportunity rather than a threat to curriculum, delivery, planning for future by reflecting upon strengths, needs, and gaps in current approaches and mitigating against any future negative effects of online learning. So we hope this kind of pandemic, and it is uncertain. We cannot say that this kind of pandemic would arise in future or not. But as of now, it is a positive opportunity of curriculum delivery and planning, so that on reflection of our difficulties or the strengths and the gaps between the present scenario and COVID period, and we can design or we can develop a good curricula which is going to be matched with the or to overcome with the negative effects of online teaching. Moving forward, COVID-19 experience to add or reinforce content about the infectious diseases to the curriculum. I know the topic isolation, quarantine, containment, proper hand hygiene, coughing, and respiratory etiquette. It is the time to move from content focus to competency-based education, especially future nurses to be prepared to demonstrate the experience in handling the life-threatening pandemic situation in future. So the nurse faculty must ensure they will be provided an education that prepares them to be knowledgeable caregivers. So in short, or in nutshell, I can say that our curricula should include the topics of infectious disease, and not for only the theory, of course, in the clinical expertise, or we can say that the competency-based education. It is not only the content-based education, it is to be competency-based education. And I hope at least a 50% of competency related to this infectious disease we had in our curricula. If not, that could be included, or we can reinforce it. And we can prepare our nursing students to be ready to face in future challenges. So with this, I can conclude how best we can provide online teaching to our students and to be justifiable educators in delivering the curricula which is necessary to train our nursing students to become a nurse practitioners with all competency required to care their patients, which includes to be capable of facing the pandemic in future. We pray that should not happen. I mean to say the pandemic of what we are undergoing and the same like would not case. If it would arise, then our student nurses to be ready to face with competence and with full knowledge to face the situation. So thanks for the opportunity provided to me. Thanks a lot. Thank you.
Participants, any questions from your side? Am I audible? You can forward if you have any questions.
Hello.
Yeah. Hello, doctor. Thank you for the session. It was really very informative. And thanks for sharing your knowledge on this current scenario. I think you have almost covered all of the scenarios related to this online education mode effect or impact on the nursing education. And thank you very much for this. And participants, any questions from your side? You can come up. Anyone? Dr. Selvarani, somebody is asking about drawbacks with online education.
Hello. Yeah.
Yeah, what are the drawbacks of online education and how to overcome from them?
Yeah, as I said earlier, the drawbacks are like the students' point of view. I can say that they can procrastinate, like in case if it is recorded lectures, and they have attentive. They should pay more attentiveness to overcome this delaying or working on their own pace. And the drawbacks in terms of in the perspectives of educators, nurse educators, like they can be more active when it is in the case of face-to-face or traditional chalk and talk education mode. So here in online teaching, although there are benefits like the teachers can develop the tools, various technologies in delivering the content or the lectures, the effectiveness, when we talk about the effectiveness in terms of students' performance or in terms of the understanding is comparably less. So that is the drawback which I can mean it over here. So that could be overcome only by mindfulness. I can say that the mindfulness of constructing and delivering and perceiving it. So that is the only way we can overcome.
Thank you, doctor. So I think in conclusion, traditional methods of teaching are missing here. And also from students' point of view, in their perspective, attention. They should be more attentive so that we can overcome some drawbacks.
Yes, of course. You're right.
Thank you very much. And any other questions, students? Yes, any other questions from attendants, participants? All right. Of course, your session is too informative. I don't think questions will be much more, doctor. And once again, thank you very much for the session and for your time. And we are very grateful to you to have your time here. And also, my sincere thanks to the King Khalid University management to allow you for this session. Yeah. Thank you very much.
So thank you once again to the management, principal, faculties for providing me an opportunity to deliver lecture over to all the students on this current scenario. Everyone, thanks a lot.
Yes, doctor. Thank you very much. Please convey my all regards to our
Oh,
faculty.
sure. Definitely, dear Manas, I happy to see you and continuing this. Okay, thank you. Thanks a lot.
Your doctor. Thank you very much. See you.
Thank you.